Hi, my name is Diane Troutman. For my family theory presentation, I have chosen the Calgary Family Assessment and Intervention Model. A theory is important for family nursing care because it provides a framework for nurses to assess and understand family issues and improve nursing care. The Calgary Family Assessment and Intervention Model is a combination of family therapy and nursing disciplines. This model is derived from the work of Dr. Carl Tom and the Family Therapy Program at the University of Calgary. It is called the Calgary Family Assessment and Intervention Model due to its origins in Calgary. This model can be utilized by nursing and other professions such as family therapy, psychology, social services, and medicine. The assessment part of this model uses questions to promote conversation between nurses and families. The response to these questions may aid family members to consider changes they could make to enhance family functioning. The intervention part of this model encourages nurses to share or develop interventions with the family to encourage and improve family functioning. The Calgary Family Assessment and Intervention Model has three main concepts: structural, developmental, and functional. The structural concept is a way for a nurse to assess the family composition. Nurses can utilize genograms and echo maps to clarify family structure. When assessing the structure of a family, nurses identify internal, external, or contextual structure. The developmental concept assists the nurse in assessing the life cycle stage of the family. This concept also helps the nurse identify individualized tasks of each family member. The functional aspect of this model is divided into instrumental functioning, which assesses the family's activities of daily living, and expressive functioning, which assesses the family's communications, roles, and beliefs. This is a Calgary Assessment Model diagram. Based upon the Calgary Family Assessment and Intervention Model, a family is a group of people greater than the sum of its parts that strive for balance between change and stability. It is composed of subsystems, yet is part of a supersystem. Health is a balanced state of being, of sound, body, and mind. Environment is the surroundings or conditions in which a person or family live in that influence their health. Nursing is the promotion and improvement of health to preserve sufficient family functioning in the cognitive, affective, and behavioral domains. Since the Calgary Family Assessment Model was developed in 1984 by Lorraine Wright and Maureen Leahy, it has been used in clinical practice globally. This model was first published in their book, Nurses and Families, A Guide to Family Assessment and Intervention. The Calgary Family Intervention Model was published in 1994 in their second edition of the same book. This model has been identified by the International Council of Nurses as a major family nursing model for nursing practice. It's been translated into 8 languages and utilized in 26 countries. It is also adaptable to other cultures. This model has been modified over time to include sexual orientation and religion, and spirituality. It uses genograms and echo maps and therapeutic questions to assess families. It has been used in education and research. Nurses can use the Calgary Family Assessment Model to guide families to identify solutions for their concerns. The Calgary Family Assessment and Intervention Model has been applied to family nursing practice by encouraging nurses to offer accommodations to families, by nurses providing recognition of family strengths during therapeutic conversations, promotion of healing, and reduction of suffering occurs. By calming the brain's panic zone, individuals and families can prevent concentrating on suffering experienced during illness. According to Wright, nurses offering accommodations to families leads to more positive thought patterns and improved neural pathways. Therefore, offering accommodations may lead to more positive outcomes for patients and their families. An example of a research project guided by the Calgary Family Assessment and Intervention Model is the research titled, "What are the benefits of a short therapeutic conversation intervention with acute psychiatric patients and their families? A control before and after study." The purpose of this research was to assess the nursing intervention of therapeutic conversation of hospitalized psychiatric patients and their families and evaluate their perception of the emotional care provided. The method of this research included psychiatric nurses of an Icelandic university hospital receiving education regarding therapeutic conversation based on the Calgary Family Assessment and Intervention Model. Between 2008 to 2009, the nurses had between 2 to 5 therapeutic conversations with 68 acute hospitalized psychiatric adult patients as well as one of their family members. The interviews consisted of completing family genograms, asking therapeutic questions, and emphasizing family strengths. The control group included 74 acute hospitalized adult patients and one of their family members. The control group consisted of non-psychiatric patients within the same hospital. The nurses caring for the control group did not receive the Calgary model training. Each patient in this study was hospitalized for more than 3 days and chose the family member he or she wanted to participate in the research. 3 questionnaires were completed by the patients and family members of the intervention group at the time of discharge. The questionnaires assessed perceived family support and patient wellness. The results showed patients and their family members experiencing therapeutic conversations with nurses educated using the Calgary Family Assessment and Intervention Model did not report a substantial difference regarding reassurance, support, and emotional wellness compared with the patients and family members in the control group. Limitations of this study included that it was not a blind or randomized study. Researchers believed an extended interventional period may yield more considerable results. Therefore, the use of therapeutic conversations guided by the Calgary Assessment and Intervention Model may be a valuable intervention for psychiatric patients to utilize in the acute hospitalized setting. Another example of research utilizing the Calgary Family Assessment and Intervention Model concepts is titled The Health Promoting Conversation Intervention for Families with a Critically Ill Relative, a Pilot Study. The purpose of this research was to assess the nursing intervention of health promoting conversations with families of intensive care patients and evaluate its effectiveness on family function and well-being and health-related quality of life. The method of the study included intensive care nurses of 2 Swedish hospitals receiving education regarding therapeutic conversations based on the Calgary Family Assessment and Intervention Model. Between 2013 to 2015, the nurses conducted 3 health-promoting conversations with intensive care patients and at least one of their chosen family members 4 to 8 weeks after discharge. Each discussion lasted 30 to 120 minutes. This randomized controlled trial consisted of an intervention group that received the therapeutic conversations and a control group receiving standard care. Each patient in this study was hospitalized in the ICU for 7 to 8 days. The conversations, guided by concepts from the Calgary Family Assessment and Intervention Model, focused on therapeutic questioning and identifying family resources to assist with family functioning. Data was collected for each group at baseline, 3 months, and 12 months. The results showed families in the intervention group reported a substantial improvement in family functioning and well-being between baseline and 3 months in contrast to the control group. By 12 months, all measurable improvements had been lost for family functioning and well-being. Families in the intervention group also reported improvement in health-related quality of life, such as stress, from baseline to 12 months compared with the control group. The study concluded that therapeutic conversations guided by concepts of the Calgary Family Assessment and Intervention Model are proven to decrease family stress and improve the mental health of ICU patients and their families. By applying this model to the family I will interview for the family assessment assignment, it will guide me to address numerous aspects of the structure, development, and function of my chosen family. I chose this model because it can assist me in asking therapeutic questions and offering accommodations during the interview process. By using this model, nurses can help families identify support available to assist them during periods of illness, and by using accommodations, nurses can help families focus on their strengths, which helps prevent panic and fear. Thank you for watching my family theory presentation on the Calgary Family Assessment and Intervention Model.